Gentlemen, thank you for speaking with us during such a busy time, as I know it always is for you. As the community continues to reel from this school shooting, I want to ask you both to start. You're both fathers. What goes through your mind when you get the report that you're receiving victims from a school shooting? We've now learned 2 of those victims are students. That you'd be receiving victims from there. Doc, I want to start with you.
When you hear about a school shooting, obviously the tensions go up a little bit, but I really think it's important to send the message that, regardless of what the situation is, we treat patients every day that come in with gunshot wounds, and it's stressful every time, but we do exceptional care. And the team comes together and we provide equal care every day to every patient that comes in with a gunshot wound.
James, what goes through your head?
It does hit different when there is a school involved, when there are youth potentially involved. But the reality is this is what we do. We're the level 1 trauma center for the county, and this is not new news. And I think we all kind of go on to autopilot and doing whatever it takes to make sure that we optimize the care and that we make sure folks are taken care of. But we're human too. And so there is the letdown afterwards, and kind of as you begin to rehash and think about it. And you're right, I am a father, and it's hard to think that anybody would think it's acceptable to perpetrate something like this in general, but around the school. So that is just, it's difficult, but at the end of the day, this team, and we've talked about the choreography, these folks are amazing. The way they go about doing what they do and making sure that they give the patients the best chance for a successful recovery.
Doctor, we'd be sensitive to patient privacy here, but broadly, can you speak to us about the damage a bullet can do, the kinds of things you are dealing with when you receive a gunshot wound victim?
Yeah, bullet injuries are devastating. It's not glamorous. It's something that we see on TV and in the movies. It is not glamorous like we see in the media. It's devastating. It destroys human bodies, and it's devastating to all parts of the body, and it injures multiple organs and makes people critically ill and frequently die.
James, you spoke passionately yesterday outside of the hospital, and you said, "This is not the Oakland I grew up in." You called yourself a son of Oakland, and you said something has changed. In your mind, what has changed?
I am not qualified, I think, to try to talk about what socially has changed. Certainly, the numbers don't lie. We have seen almost a doubling in the past 2 years over the amount of violent victims of crime that we're seeing in our trauma center. As a son of Oakland, as a resident of Oakland, I'll tell you that there was more respect for life when I was growing up, and that's what I think is missing. There is a callous disregard for life that I see in the streets today, and I have an obligation to speak on that, but also to lean in and to try to do my part. And so as the leader of the health system, there are a number of programs that we have that I think are really about trying to give people resources to address health disparities that we see in communities of color. And so at Alameda Health System, we're prepared to lean in and do our part to try to help give people the faith, the belief that life is valuable, life is precious, and they should not be so callous in the way that they treat others.
Doctor, some staggering statistics released by your hospital yesterday that we are already seeing twice as many gunshot victims, 21 and 22, compared to the last 2 previous years, as James said. Right. That was coming out of COVID, or the heat of COVID, when this system and your physicians were already strained. Yeah. So as we continue to see this upward trend, how damaging and how stressful is it for your staff, not only physically, but mentally and emotionally?
Yeah, I'll start with the mental and emotional component. I think we all want to work at Highland Hospital for a reason, and in Alameda Health System for a reason. It's a dream job. Like Mr. Jackson said, for him, it's my dream job as well. And part of that is getting to serve the underserved community. That's why I wanted to go into medicine. And the emotional component of seeing the violence every day really does hit home, because if you look at COVID, it disproportionately affected underserved communities, specifically Oakland. And if you take that map and you overlay it with a map of violence, and specifically gun violence, they are almost the same map. Gun violence also disproportionately affects the underserved community, and the two of them have been like gasoline and fire, right? So, you ask about the emotional component, and it does add up when you start seeing every day multiple gunshot wounds coming in that we're treating and sometimes dying. Homicide is the #1 cause of death for young men of color, and not just in Oakland. This is a national problem, right? It's across the country, and it's just not okay, right? It's something needs to be done about it. So that's the emotional component, right? So in terms of the stress on the team, we have built into a trauma center redundancy, and we can handle multiple gunshot wounds at one time. That's, thanks to the support of a wonderful administration, we're able to do that, and that's what it means to be a trauma center, right? We have the staff, we have the orchestrated systems in place that really do come together like a team, not like a team. The ultimate team sport is trauma, and we can take care of all these patients that come in every day.
James, when you consider that the communities that are most impacted by gun violence are lower income communities of color, you're a man of color, you grew up in Oakland. So what does that tell you about the solution needing to be holistic, need to result in systemic change?
That I think it's not the moment that a gun battle breaks out. This is something that greatly precedes that. And so the community that I grew up in, there was a respect for life. People had disagreements, they had fights. Oakland has never been a soft city, but people didn't finish their arguments by killing somebody. That's not the town that I grew up in. And having said that, I have an obligation as a man of color to reach back and to make sure that I'm doing what I can. And from my vantage point as the CEO of the safety net organization that serves this entire county, I do have a great obligation to make sure that we are being proactive and helping provide resources. We have a program called Recipe for Health that is led by Dr. Stephen Chin, and this is through the Healthcare Services Agency of Alameda County. Colleen Chavla is the executive director, an amazing colleague, and Dr. Chin has a program called Recipe for Health, and it uses food as medicine. And so we are actively trying to push this program forward to address food deserts, people who don't have enough sustenance, and so kids should not go to school hungry. And so I'm terribly proud of the work that we're doing in concert with the Healthcare Services Agency and Dr. Chin. We have the beloved Black Birthing Program, Centering Program, which is about addressing disparities in birth outcomes for expecting mothers and new babies. And so we're working to make sure that they have healthy outcomes in a way that they might not have had previously. We have our Bridge program, which is about substance abuse. And so it's about not criminalizing people who have substance abuse issues, but giving them the resources to address their dependency. And so the Alameda Health System is working very hard to reach out and to help people before they get into a violent state. And then we work closely with Youth Alive, which is a program that really looks at victims of violence, but also their families and those around them, and tries to break the cycle of violence. And so the health system is actively working to do more than just fix people once they're broken. We have the best team around to do that, but we want to take some of the work off of their shoulders. We want to try to break that violent cycle.
Doctor, as James said, you are incredibly good at what you do. Your team is the best. And we spoke to you when you saved Ursi Joyner's life. We're speaking to you in this circumstance, but I have to imagine that as many lives as you save, there are ones that are lost.
Yes, unfortunately.
How difficult is that you cannot save everyone?
Oh, it's it's devastating. It's very difficult. But it is, part of being a trauma center and taking care of critically injured people. We can't save everyone, but we save the vast majority of the people that arrive at our hospital. If they arrive alive, 99% of them are going to make it out. So we have an exceptional team resuscitating, operating, and getting people saved and healthy.
Gentlemen, part of why we are here is that we are speaking about a tragedy and a school shooting. But the point that we also want to make, and I know you do too, is that it's not just these large events. It is an everyday occurrence that you are seeing this kind of gun violence and these kinds of trauma patients. So I'd like to have you speak about that a little bit, about what you want the community to understand, that this is the reality we're in Oakland right now. James?
Thank you, Greg. I appreciate you calling that question, because the reality is the numbers don't lie. There is more violence. An episode like the one that happened yesterday is splashy and it gets the attention. And so I'm grateful for this opportunity to talk, but the reality is we're seeing more every day. Dr. Browder and his team are inundated. It's not a lie to say. We have something called code triage and code red in the ED when the volumes are such that we've got to change the way we're operating as a hospital to address the fact that we are seeing increased volumes in the ED. And I see those codes far too often because of the volume that's coming into the ED. And so we're working internally to make sure that we are, he said there are built-in redundancies, and there are. We have plans for dealing with that, but it's just too much. The other thing I need to speak to is what we're doing to take care of the caregivers, because these folks every day are experiencing stresses that people just typically don't have to go through. And so it takes an emotional and a physical toll. And so as an administrative team, we're working very hard, one, to acknowledge that that sort of trauma accumulates, and then what are we doing to give them resources to manage that built up, pent up pressure that these folks are experiencing. And so that's something that we haven't gotten it figured out completely, but we're actively working on that, because who cares for the caregivers? Every week I do a desktop chat with the entire organization, and I start it by reading cards that we've received from the public, because we get so much support from the public. And so I just take one of those cards and I read it, that people send in, sometimes anonymously, sometimes with their name, just saying thank you to people like Dr. Browder and the caregivers at the Wilmington Highland Hospital and across the Alameda health system, because the public gets it, and administratively we're just trying to do our part to make sure the caregivers have what they need to keep doing what they do.
Yeah, and we feel that. It all starts with supportive administration that will give us the resources to do what we need to do to take care of these patients every day. Like we said, trauma is the ultimate team sport, and it starts with the administration. So, we're very grateful, and that's what allows us to keep going, right?
As we sort of wrap up here, this community is angry, this community is frustrated, and rightfully so. So what would be your message? You spoke about leaning in. So what would be your message about what the community can do, what they should do, and perhaps maybe this is a turning point in the violence that you continue to see firsthand in the city of Oakland? And Doctor, I'll let you start.
Yeah, I would like to say that, going on what Mr. Jackson said, is that the high-profile shootings that happen get everyone's attention, but we want everyone to know that this is happening every day and that it's getting worse every day, and it is a public health crisis. This is a public health crisis that needs to be addressed on the highest levels. Yeah, that's what my message that I would want to get out, right?
Thank you, Dr. Browder, and you're spot on. I would just say that we should not accept this. We cannot accept this as the new normal. We all have to try to do what is within our scope to make sure that we don't accept the level of violence that we're seeing. I was on a call this morning. Mayor Schaaf had pulled together a number of leaders to talk about what can be done, and she talked about engaging the federal government and bringing in resources from the national level. I think that's right. I think it's correct, but I don't think that we can look to others to solve our problems. I think that we have to collectively as a community come together and work together to make sure that nobody finds this acceptable. This should not be our state. Something has changed. I'm here to tell you, I've lived it, I know it. This is not the Oakland I grew up in, and I don't accept this. And I'm willing to do what it takes to get us back to a community that cares.
Yeah, we know we can do it. Oakland's done it before, right? I mean, the crime rate, the homicide rate, the gun violence rate was dramatically decreased when a concerted effort at the city level was done. Just before the pandemic, Oakland was poised to have the lowest homicide rate in its history. And then it's all exploded from there. Right? So we can do it, and we know we can do it. We just need to be leaders and get the word out that it's happening. Right? It's not just the big events that you hear. It's happening every day, and so we all need to be aggressive and chip in, lean in. You want to say it that way to solve this problem, right? And it comes from our community, absolutely. I don't think we can rely on other people to come in and do that. I don't know if you wanted to talk about our violence prevention program.
About Trauma Navigator?
Yeah.
Is that, yeah. If you'd like to speak to Trauma Navigator, please, because I know that's another one of the programs that you're engaged in.
Yeah, so I think one of the things as leaders at our hospital that we're working on is our hospital-based violence intervention program. So that's one of the avenues where we can make a difference. Once patients come into the hospital, we treat their life-threatening injuries. We see that as a moment where we can intervene and give them resources to recover and get out of the situation that they may have been in, right? And so we have lots of community partners that we partner with, and we can provide resources to these patients in terms of education, if they have housing insecurity, food insecurity, jobs, Faith in Action, Youth Alive, all these organizations are organizations that we partner with, and we can help offer resources to them after they recover from their injuries.
I'm so glad you said that, Dr. Browder. I believe that synergies are going to be critical. We are greater together than we are individually, and so working with the community partners that Dr. Browder just mentioned and others, that's where I think the magic will be. That's what we can do as opposed to trying to go our own way. We need to be collaborating and really taking advantages of the talents that are in this community to create a safer place for us all.